Cardiorespiratory training concepts. The purpose of this presentation is to provide the health and fitness professional with fundamental concepts regarding cardiorespiratory training. This presentation will also allow the health and fitness professional to select and administer the appropriate cardiorespiratory protocol for all clients. Following this presentation, the participant will be able to define integrated cardiorespiratory training, describe how cardiorespiratory training is used within an integrated training program, provide the guidelines for proper cardiorespiratory training, design cardiorespiratory training programs for a variety of clients, and perform and instruct appropriate cardiorespiratory techniques. Cardiorespiratory training is simply training that involves and places a stress on the cardiorespiratory system. This means that any form of activity, such as walking on a treadmill, playing basketball, or weight training, can be used as a form of cardiorespiratory training. This is a major concept that can be used to the health and fitness professional's advantage, allowing him or her to maximize the efficiency of the time spent with a client. All exercise, regardless of the duration and/or intensity, must utilize the cardiorespiratory system to either sustain the activity and/or recuperate from it. Cardiorespiratory exercise in the fitness industry is traditionally viewed as requiring a certain piece of machinery, such as the treadmill, stationary bicycle, or stair climber. In this example, cardiorespiratory training becomes a separate component of an overall workout program that is used in a few distinct ways. These include the warm-up, cool-down, and the workout itself. The warm-up. A warm-up is generally described as preparing the body for physical activity. It can be either general in nature or more specific to the activity. A general warm-up consists of movements that do not necessarily have any movement specificity to the actual activity to be performed. Examples include warming up by walking on a treadmill or riding a stationary bicycle prior to weight training. A specific warm-up consists of movements that more closely mimic those of the actual activity. Examples include performing body weight squats and push-ups prior to weight training. Some benefits of a proper warm-up include an increase in heart and respiratory rate, an increase of tissue temperature, and to prepare the client psychologically for exercise. NASM suggests that the cardiorespiratory portion of a warm-up should last 5 to 10 minutes at a low to moderate intensity. However, depending on the client's goals and objectives, this can be altered. Furthermore, the cardiorespiratory portion of a warm-up is usually considered a general warm-up. A complete warm-up should include a general and a specific warm-up. Here we can see a sample warm-up for a stabilization level client. The warm-up will include 5 to 10 minutes of self-myofascial release, 5 to 10 minutes of static stretching, and 5 to 10 minutes of cardiorespiratory exercise. Here we see an example of a warm-up for a strength level client. The warm-up will include 5 to 10 minutes of self-myofascial release, 3 to 5 minutes of active isolated stretching, and 5 to 10 minutes of cardiorespiratory exercise. Here we see an example of a warm-up for a power level client. The warm-up will include 5 to 10 minutes of self-myofascial release and 5 to 10 minutes of dynamic stretching. When performed in a circuit, the 10 minutes of dynamic flexibility can act as your cardiorespiratory warm-up as well. The workout and cool-down. Most people who perform cardiorespiratory exercise are looking for improvements in their health and/or fitness levels. However, it's been suggested that there is a difference between the level of activity required for health versus that necessary for increased fitness or cosmetic goals. It is viewed that activity levels that may not necessarily produce significant improvements in fitness may have marked effects on health. In either scenario, cardiorespiratory activities and/or exercise have a profound effect on the overall physical and mental health of a participant. Some benefits of cardiorespiratory activities and/or exercise include decreasing daily fatigue, anxiety, depression, coronary artery disease, hypertension, non-insulin-dependent diabetes mellitus, cancer, osteoporosis, and obesity. These benefits accrue as the result of many physiological adaptations to cardiorespiratory training. Some adaptations to cardiorespiratory training include an increase in maximal oxygen uptake, stroke volume, cardiac output and oxidative capacity of muscle, and decrease in heart rate. A cool-down provides the body with a smooth transition from exercise back to a steady state of rest. In essence, a cool-down is the opposite of the warm-up. This portion of a workout is often overlooked and viewed as less important than the other components. However, proper use of a cool-down can have a significant impact on a client's overall health. Sufficient time for a cool-down period is approximately 5 to 10 minutes. Benefits of a proper cool-down include possible improved flexibility, removal of waste byproducts via the blood, minimize muscle soreness, allow cardiorespiratory system to respond to lower demand, avoid dizziness and/or possible fainting, and provide an emotional balance following exercise stress. If an individual is performing cardiorespiratory exercise for an extended period of time, it will be vital that he or she slowly decrease the intensity of the exercise, generally 40 to 50% of maximum heart rate, and work at this lowered intensity for 5 to 10 minutes. This will help in gradually decreasing the heart rate back down to a resting state. It will also ensure that blood does not pool to the lower extremities, leading to dizziness and/or possible fainting. Flexibility is also an important component to be utilized in the cool-down. Because one of the goals of a cool-down is to relax muscles and bring them back to their original resting length, corrective stretching, such as self-myofascial release and static stretching, would be the appropriate form of stretching during a cool-down. General guidelines. Any form of training must have certain guidelines to allow for the development of a proper program. These guidelines also serve to quantify activity. For these purposes, NASM uses the FITTE factors, otherwise known as frequency, intensity, time, type, enjoyment. Frequency refers to the number of training sessions or activity sessions for a given time frame. The time frame usually consists of a week, but depending on the client and his or her goals, it may be one workout a day, a month, or a year. Intensity refers to the level of demand the activity places on the body. This is usually measured by heart rate and/or maximal oxygen consumption. Time refers to the length of time engaged in the activity. This is usually measured in minutes. For general health requirements, approximately 30 total minutes a day is recommended. Type refers to the mode or activity utilized. This can be virtually any activity, such as using stairs versus elevators, parking farther from the desired location and walking a longer distance, walking on a treadmill, or using an elliptical trainer in the gym. Enjoyment refers to the amount of pleasure derived from the activity by the client. Exercise parameters used for improved health have been shown to differ from those that are recommended for improved fitness levels. This is important for the health and fitness professional to realize, especially for first-time and/or deconditioned clients. Any activity above what the client is currently involved in will produce some benefit. These two charts illustrate general guidelines for improved general health and improved fitness. Keep in mind, the fitness guidelines shown may be too extreme for the beginning client. Many clients will not be able to perform the fitness level guidelines for integrated cardiorespiratory training of 20 minutes at 60% of heart rate maximum for 3 to 5 days per week. However, accumulating a total 30 minutes of exercise per day over a 5 to 7 day period may be more attainable. It has been shown that performing 3 10-minute bouts of exercise is just as effective as one 30-minute continuous bout of the same exercise. Also, one's exercise intensity may need to be lower than those provided and progressively increased as they become more conditioned. Relation to appearance. While many clients and health and fitness professionals realize the overall benefits of cardiorespiratory exercise, the primary manner in which it is utilized is as a workout to reduce body fat. It is generally assumed that body fat reduction can only result from extended periods of time on a piece of cardio equipment or in aerobic classes. There is still a popular trend of thinking that suggests there is a magical fat-burning zone for exercise. However, body fat reduction can only take place when there is more energy being burned than consumed. This is known as the law of thermodynamics. Typically, the fat-burning zone is thought of as the time when the body is mainly using fat as fuel. However, to design appropriate cardiorespiratory training programs, the energy systems used at different generalized heart rate zones must be examined. Fat and glucose are major sources of fuel for exercise. In order for them to be used more efficiently, the body must be able to receive enough oxygen. Oxygen allows fat and glucose to be burned as fuel. This, in turn, produces the waste products of carbon dioxide and water. The amount of oxygen and carbon dioxide exchanged in the lungs normally equals that used and released by body tissues. This allows the body to use these respiratory gases to estimate caloric expenditure. The respiratory exchange ratio is the ratio of carbon dioxide produced to the volume of oxygen consumed. To estimate the amount of energy used by the body, first, determine the type of energy sources, carbohydrate, fat, or protein, that are being burned for energy. The fact that fat and carbohydrates differ in the amount of oxygen used can help to determine what kind of fuel is being used. Here, we see a chart detailing respiratory exchange ratio and caloric expenditure. As you can see, the body uses the highest percent of its fuel from fat when the body has a respiratory exchange ratio of 0.71. If the body uses a maximal percent of its fuel from fat at 0.71 respiratory exchange ratio, then why shouldn't an individual exercise at this level all the time? The answer lies in the fact that the only time the body can be at 0.71 respiratory exchange ratio is when it is at complete rest. This is how the fat burning zone originated. Though the percentage of fat being burned is maximal, the amount of energy or calories used is minimal, and therefore not very productive for the goal of weight or fat loss. Remember, it's not how much fat an individual burns that ultimately dictates body fat reduction. Instead, it is how many calories are burned. Health and training professionals should maximize the caloric expenditure of a training session for weight loss clients. This is made easier by maximizing the oxygen consumption needed for the duration of, as well as the recovery from, the training session. This recovery oxygen consumption is known as excess post-exercise oxygen consumption. Excess post-exercise oxygen consumption is simply the state where the body's metabolism is elevated following exercise. This means that the body is burning more calories following exercise than before the exercise was initiated. Think of it as a caloric afterburner that is caused by exercise, much like a car engine stays warm for a period of time after it's been driven. Following exercise, the body must utilize increased amounts of oxygen to replenish energy supplies, lower tissue temperature, and return the body to a resting state. Research has indicated that the higher the intensity of the training session, the greater the magnitude of this afterburn effect. Stage training. In order to ensure continual adaptation, cardiorespiratory training programs must be designed to progress in an organized fashion and to minimize the risk of overtraining and injury. This is the basis behind the stage training system. Stage training is a three-stage programming system that uses different heart rate training zones based on one's respiratory exchange ratio. Those zones are organized to maximize cardiorespiratory training benefits. The three different stages of cardiorespiratory training mimic the three stages of training seen in the OPT model. Each stage will help to create a strong cardiorespiratory base to build on in subsequent stages. Before discussing each stage, it's essential to know how to translate respiratory exchange ratio into heart rate zones. This table demonstrates estimated heart rate numbers that coincide with the respiratory exchange ratio to give a predictable and usable number to work with. Also shown are the energy systems, energy source, and example activity. The heart rates are broken up into three heart rate zones that are easily used for program design. Just like in weight training, a base needs to be established first. In Stage 1, clients should start slow and work up to 30 to 60 minutes in Zone 1. 65 to 75% of maximum heart rate should be low enough to ensure the client is in an aerobic state. Stage 1 training also helps a client to better meet the muscular endurance demands of the stabilization level of training in the OPT model. There may be times, however, that even this zone will be too high for some clients. In this case, the general health activity recommendations mentioned earlier will become very important guidelines to follow. Stage 2 is for the intermediate client who has built a good cardiorespiratory base and will use heart rate zones 1 and 2, or 65 to 85% of heart rate maximum. The focus in this stage is on increasing the workload in a way that will help the client alter heart rate in and out of each zone. Stage 2 training helps increase the cardiorespiratory capacity needed for the workout styles in the strength level of the OPT model. It's important to alternate days of the week with Stage 1 training. This means alternating sessions every workout. Stage 2 is the introduction to interval training, in which intensities are varied throughout the workout. Start by warming up in Zone 1 for 5 to 10 minutes. Next, move into a 1-minute interval in Zone 2. Gradually increase the workload to raise the heart rate up to Zone 2 within that minute. Once the heart rate reaches 80 to 85% of maximum heart rate, maintain it for the rest of that minute. After the 1-minute interval, return to Zone 1 for 5 minutes. Repeat this if the client has time and can recover back into the Zone 1 range. The faster an individual can recover back to Zone 1 heart rate after an interval, the more efficient their cardiorespiratory system is becoming. Stage 3 is for the advanced client who has built a very good cardiorespiratory base and will use heart rate zones 1, 2, and 3. It should not be used by beginning or intermediate clients. Failure to comply with these standards could result in a critical health-related injury to a client. The focus in this stage is on further increasing the workload in a way that will help the client alter heart rate in and out of each zone. Stage 3 training increases the capacity of the energy systems needed at the power level of the OPT model. Start with a warm-up in Zone 1 for 5 to 10 minutes. Then, increase the workload every 60 seconds until reaching Zone 3. This will require a slow climb through Zone 2 for at least 2 minutes. After pushing for another minute in Zone 3, decrease the workload to Zone 2 for 1 minute. If the heart rate does drop to a normal rate, overload the body again and go to Zone 3 for 1 minute. After this minute, go back to Zone 1 for 10 minutes before starting over, and repeat. Stage training is very important. Simply increasing the intensity for the same type of training will not produce consistent increases in fitness levels and weight control, as the body will soon adapt. By increasing a client's intensity through the 3 heart rate zones seen in Stage 3 training, the client can take greater advantage of excess post-exercise oxygen consumption and help ensure greater results. Circuit training. One of the most beneficial forms of cardiorespiratory training is circuit training. Circuit training programs consist of a series of resistance training exercises that an individual performs one after the other with minimal rest. Circuit training allows for comparable fitness results without spending extended periods of time to achieve them. An example would include performing a ball dumbbell chest press, then without rest perform a standing cable row, then a standing overhead dumbbell press, then a standing dumbbell curl, then a ball dumbbell tricep extension, and then finally a step-up performed before resting. Circuit training is just as beneficial as traditional forms of cardiorespiratory exercise for improving and/or contributing to improved fitness levels. Circuit training produces greater levels of post-exercise energy expenditure and strength and near-identical caloric expenditure for the same given time span when compared to walking at a fast pace. Circuit training can also incorporate traditional cardiorespiratory exercise into the routine. Here's an example for a stabilization level client. First, perform 5 to 10 minutes of stretching, then 5 to 10 minutes of cardiorespiratory exercise at Stage 1 or 65 to 75% intensity. Then perform 15 to 20 minutes of a circuit training routine. Then perform a second round of Stage 1 cardiorespiratory exercise for 5 to 10 minutes. Finally, cool down for 5 to 10 minutes with corrective stretching. Here's an example workout combining circuit training and cardiorespiratory training for a strength level client. Again, start with 5 to 10 minutes of stretching, which would include active isolated stretching versus static stretching. Second, perform 5 to 10 minutes of Stage 2 cardiorespiratory training, or 80 to 85% intensity. Third, perform a circuit weight training routine. Fourth, perform a second round of Stage 2 cardiorespiratory training for 5 to 10 minutes. Then, finally, cool down for 5 to 10 minutes using corrective stretching. Lastly, here's an example workout combining circuit training and cardiorespiratory training for a power level client. First, perform 5 to 10 minutes of stretching, this time using dynamic stretching versus static or active isolated stretching. Second, perform 5 to 10 minutes of Stage 3 cardiorespiratory training, or 86 to 90% intensity. Third, perform 15 to 20 minutes of circuit weight training. Fourth, perform a second round of cardiorespiratory exercise for 5 to 10 minutes, this time at stage 2. Finally, cool down for 5 to 10 minutes with corrective stretching. Postural considerations. As any form of cardiorespiratory training involves movement, it must follow the same kinetic chain technique parameters as flexibility and resistance training exercises. Clients with a rounded shoulder-forward head posture tend to elevate and protract their shoulders and extend the cervical spine while using bicycles, treadmills, and elliptical machines. On steppers and treadmills, watch for the grasping of the handles, which will cause elevated and protracted shoulders and a protracted head. If possible, this equipment should be used without the assistance of the hands to increase the stabilization component, elevating the caloric expenditure and balance requirements. In settings where a television is present, watch for excessive cervical extension or rotation of the head to view the television. Clients whose pelvis is rotated anteriorly or whose low back arches tend to hyperextend their low back and minimize hip extension. Initial use of bicycles and/or steppers may not be warranted, as the hips are placed in a constant state of flexion, adding to a shortened hip flexor complex. If they're used, emphasize hip flexor stretches prior to and after use. If using a treadmill, the speed should be kept to a controllable pace to avoid overstriding. The client's hips are not able to properly extend and will cause the low back to overextend, placing increased stress on the low back. Hip flexor stretches should be emphasized prior to and after use. For clients whose feet tend to turn out and/or knees move inward, use of all cardio equipment that involves the lower extremities will require proper flexibility of the ankle joint. Emphasize foam rolling for calves, adductors, IT band, tensor fascia lata, and latissimus dorsi, as well as hip flexor stretches. In the fitness industry, cardiorespiratory exercise is typically associated with certain pieces of equipment. However, the cardiorespiratory system is used to either sustain or recover from all physical activity. Cardiorespiratory training can be used as the warm-up, cool-down, or as the workout itself. Regardless of a client's goals, cardiorespiratory training should be incorporated into the program. The FITTE guidelines allow for the development of a proper program and quantify its variables. Recommendations include frequency, almost every day of the week for short quantities of time. Intensity, moderate enough to increase heart and respiratory rates. Time, 20 to 60 minutes total a day, depending on goals. Type, any kind of activity from gardening to weight training. And enjoyment. The program and its activities should coincide with the personality, likes, and dislikes of the client. Stage training is a 3-stage programming system that uses different heart rate training zones based on the respiratory exchange ratio. Zone 1 consists of a heart rate of approximately 65 to 75% of a predicted heart rate maximum and is intended for beginners and used as a recovery zone for more advanced clients. Zone 2 is near the anaerobic threshold at 80 to 85% of the heart rate maximum and is intended for individuals who have progressed to the strength level of the OPT model. Zone 3 is at 86 to 90% of heart rate maximum. These zones can be translated into 3 stages, which dictate in which zone and for what length of time cardiorespiratory activity should be performed. Because movement is involved, like all other forms of exercise, it is vital to monitor kinetic chain checkpoints with clients who are performing cardiorespiratory activity. This increases neuromuscular efficiency and decreases the risk of